Good evening. Man, what a difference between today and Tuesday. Tuesday was bright and sunshiny, and it was just warm. And then today, the wind and the rain and the cold, it almost felt like it was going back into winter, sadly. I can't wait for spring and summer to fully roll out. Can't you guys? I want to welcome you guys tonight. We have a special program tonight on, I will let the speakers share what they're doing. I want to open it up with a quick word of prayer, and then Pastor Mills will have our What's the Connection. We will not have a life hack because the entire presentation tonight will be a life hack. So, let's offer a quick word of prayer. Father in heaven, thank you for your love and kindness. Thank you for being with us tonight and bringing us here so that we can learn more about how to treat our bodies and take care of them, Father. Join us, guide us, and give us wisdom and understanding. In Jesus' name, amen. Pastor Mills.
Good evening. It is good to see each one of you here. Welcome. Tonight we're going to be looking at natural remedies, and I know you're in for a real treat. I'm glad each one of you came to join us. In the What's the Connection this evening, I want to take you to a story that you'll find in the Old Testament. In fact, if you have your Bibles, you're welcome to turn with me. If you don't, you'll find Bibles in front of you. Isaiah chapter 38 contains this interesting story about King Hezekiah, who was the king of Israel. And Hezekiah he was a good king. He did a lot of good things in the kingdom, but he got very sick. And so near the end of his life, he gets sick, and God sends through his prophet Isaiah, goes to Hezekiah and says, "This sickness is unto death." And Hezekiah weeps. He puts his face against the wall, and he begins to cry, and he, more importantly, begins to pray that God will heal him. And you know, God heard the prayer of his child. You know, God listens to us when we pray. And when we come before the Lord, he helps us in our time of need. And as Hezekiah is praying, God sends a message to Isaiah. He says, "Go back and tell Hezekiah that I am going to save him." And then God did something very interesting. He told him to do something to bring his healing. If you go down to verse 21, you'll see what the Bible recounts. Now Isaiah had said, "Let them take a lump of figs and apply it as a poultice on the boil, and he shall recover." Question: who healed Hezekiah? But what did God use to heal Hezekiah? He worked through natural remedies. Every boon of health you have, every moment of feeling better is a blessing from the Lord. But God will work through the items he has chosen to bring health. Exercise is a way of increasing health. Eating right, as we've heard about over many of the different lectures. Dr. Schwelt last Tuesday evening it was powerful on how diet and the time even of when you go to bed and get up, what a difference that makes. But there are also natural remedies for when we do get sick that God has given us that will help us to feel better. And God will work through those to give us full health. So, what's the connection? What we're going to hear tonight, these different natural remedies are blessings that God will work through to bring health to your life. And I know you're in for a real treat.
All righty. Well, thank you for that, Pastor Mills. I'm going to introduce our speakers, and then we will have a musical piece from Kevin Brooks. Speakers Rich and Ronda Smith, RN, have many, so I take it Miss Smith is the RN. Okay. Have many years of health education experience in both community as well as residential lifestyle disease reversal programs. Rich is a massage therapist, an exercise coach, and has seen hundreds improve at New Start, Black Hills Academy, Oak and Lifestyle Center, right? Yes. Oak Haven Health and Oak Haven Health Centers. Rhonda is a registered nurse and has been nursing director at multiple health centers. At these health centers, they have both taught and used hydrotherapy, the use of water in all its forms as a modality for colds, COVID, and other common ailments. They have shared their experience, training, and passion with many audiences worldwide and have produced a hydrotherapy training course. Those are our speakers for tonight, and I am looking forward to it. Kevin.
Well, was that lovely or what? I mean, what can you say? It's beautiful. Well, I'd like to say greetings from, we flew in from Arizona today. Greetings from sunny, and might I add, warm Arizona. We were in the 70s. So anyway, glad you could be here. This evening, what we're going to do is we're going to compact hours worth of information into a little teeny tiny bit of time. So we're going to skip a lot, but we're going to hopefully give you some information that you can go home with and use, because guess what? It works. So first of all, I'm going to do a little introduction just to kind of give you an overview of what hydrotherapy is. Who knows what hydrotherapy is? Okay, and who has used hydrotherapy? Well, that's great. Very good. For those who are, hopefully those who have, you'll gain a little bit of a snippet of information. You know how that can be? You can kind of grab something that you hadn't heard before or implement something you hadn't heard before. For those who haven't and who are not familiar, this should be kind of interesting for you, I hope. So, hydrotherapy, water treatments made simple. Let me get my clicker going here. In the book, Ministry of Healing, it says every person should have a knowledge of nature's remedial agencies and how to apply them. You know, that quote has probably never been so relevant than it has been in the last 2 years because of what's been going on, because it's definitely been very helpful for many, many people in the last couple of years. What is hydrotherapy? Well, hydro is water, therapy is cure, so water cure. The treatment of disease by the use of water. That's how simple it is. So, perfect health depends on what? On perfect circulation. So how would we accomplish that in a practical way? How do you think? Yes, we can use actually even, yes, contrast, that's right, but even just the use of hot or the cold will actually improve circulation as well. So, the effects of hot, it is going to increase blood flow, dilate the blood vessels. It's going to increase metabolism. So metabolism, if you can speed that up, you can speed healing up. Because it's speeding up the reaction of the chemicals of the body. It's going to speed up the red and white blood cell activity, the pulse and the respiration. That's something you have to be kind of aware of whenever you're using particularly hot or warm, that the pulse and the respiration is going to go up. So you don't want to get the pulse and respiration too high, or somebody's liable to get a little dizzy. It's also going to increase perspiration. So why do you suppose that would be good? We don't sweat enough, do we? Especially in colder climates, we just don't sweat enough. And perspiring is a wonderful way to get things, bad things out. Effects of cold, blood flow constricts blood vessels, and it decreases organ congestion. It's interesting because if you look at disease, for the most part, I like to say I always step out on a limb here, but if you look at disease, it generally is, the problem is a congested area, congested organ. So what we want to do is we want to use something that is going to decongest that organ or that system in the body. So it helps do that. Muscle reaction, that has to do with maybe a injury in a limb, like a ankle sprain or whatever, shoulder sprain. You can slow down the muscle reactions, and thus it can reduce the pain as well. Will decrease pulse and respiration, of course, and decrease pain. Okay, the general effects of hot and cold. Speeds the body's healing ability by increasing the nutrients for healing, the red blood cells, which are the oxygen carriers, and the white blood cells, which are the immune systems. The red and white blood cells are, in illness, are the two that really take a hit. Of course, the white cells, immune system gets suppressed, and then the disease can kind of take over, and that's just what it does. Kind of takes over the body systems. Also, waste product removal. Now, a good thing to point out is, have you heard of New Start? Okay, I'm sure a lot of you have. For those who have not heard of New Start, I'm just going to go through real quickly. But whenever you're looking at hydrotherapy and you're ill, you can't just use hydrotherapy and say, oh, well, okay, that's all I need to do. Disease does not come without a cause. And you have to start at the beginning of that process. And whenever you get ill, you say, okay, I can use hydrotherapy and it can help me get over this illness more rapidly, but what else do I need to look at to possibly not get ill as often or as frequently or severely? And New Start is a great way to find out where you have been weak, where your weaknesses are in your lifestyle. And the first one is nutrition. Look at your diet. How's your diet doing? And that's, by the way, I'm not going to go through these because we just don't have time, but exercise, another one. Increase blood flow throughout the body. Water. Are you getting enough water? For the most part, people are really kind of chronically dehydrated. And you'll probably notice if you've ever been to the hospital or gone to the hospital and seen anybody, what is the first thing they do when they get you to the hospital? They plug you into hydration. So, because they know that most likely you're dehydrated. Sunshine, the benefits of sunshine. Temperance. Temperance meaning the, and doing away with those things that are bad for you. So, temperance. It's kind of an old-fashioned word, but it holds a lot of power. Fresh air. Of course, you got a lot of fresh air here, don't you? With the wind blowing. Hoo-wee. Rest. Rest, not only sleeping, but also recreation as well. Getting away from the pressures and enjoying some outdoors activity. Trust in divine power, of course, is the very foundation, as you can see at the bottom of the, you say, that's the bottom of the list. No, that's actually the foundation of all of those. So, signs of serious illness. Now, we have
there's a handout.
We actually have a handout for you. Should we do it?
Yeah, let's do.
Okay, we're going to hand those out. If you promise, don't get distracted and stop listening. That's the.
The reason we're passing these out, I guess I have my own microphone. Is this on? Can you hear me? Okay. The reason we could give you a handout for every treatment and everything, but we really feel like this is the most important because even though hydrotherapy is amazing what it will do, there is a time when you may need to get some medical input from a medical personnel. And so we want you to know these are some things that when these things happen, you need to get some medical advice, especially if you're a layman. You know, hydrotherapy, any of us can learn to do this, and it's amazing. It works whether you know exactly all the cause and germs and everything that's causing it, but there is a time when you need to have expert opinions. And so these are some guidelines. When these things start happening, you need to get medical input, and then at the end, there is a series of questions that you will want to have in mind so that when they ask you, they may ask you some of those questions about what's been happening. Okay? So I think that's
Especially when it comes to like telemedicine, it's becoming more and more prominent. And if you have your little list there and you have the answers to that, you can convey that information much more readily. So it's a pretty helpful little cheat sheet, basically.
Yeah. Okay. There's so much that we could say today, but there's a couple things before we even get started that I'd like to encourage you to do. If you're really serious about using hydrotherapy and feeling comfortable, practice it on well people. What I have found is that people, even though they can go to 100 seminars on hydrotherapy, but when it comes to someone that is sick, they feel intimidated and don't feel comfortable doing a treatment on them. Oh dear, they're sick. What if I make them worse? Or what if I... So practice it on well people so that you feel comfortable when someone is sick, okay? That's one thing. Another thing is have someone do the treatments on yourself. That is as beneficial. You'll learn the importance of making those hot and cold changes quickly, because you'll experience it. You will learn so much by having someone do it on you, especially if they make a few mistakes. You will learn how important those little things are. And so we're going to go through some treatments tonight, specifically ones that are addressing enhancing the immune system. Dr. Schwelt the other night talked about some things with exercise and sunshine and rest. All those are very important, especially if you're sick. But these are some things that are even more, shall we say, aggressive, that can stimulate your body to do what it was made to do. You know, our bodies were made to heal themselves. But these are some things that God has given us to even speed those up, to augment what our bodies, to help them do it faster and better, okay? And when you're sick, that's what you want, okay? So the first thing we're going to do is a real simple treatment. In fact, all of these are simple. As you'll see, you'll walk out of here and say, you know, I think I could do those. And you can. So don't feel intimidated, even if you don't do it all perfect. Okay? So my model here, we're going to do steam inhalation as the first one. And my model, you want to pull a chair. Now this can be done, what I often do is just get a kettle on the stove and stand over the stove. We're going to just inhale some steam, okay? And this helps if you have dry upper respiratory mucous membranes, if coughing, any of those things. And I've heard, now I can't document this, but it sounds logical to me, that if the heat itself will actually kill some of the germs. What I heard was 135 degrees kills COVID. And so since in the nasal passages, it's not going to obviously do it throughout your whole body. It's going to kill them right where it has contact. Now, you know, I don't know if we can, it seems like we could get it that hot, the steam, but you don't want to burn yourself. But you'll realize when it's too hot. Stop breathing it. Okay. So steam inhalation is just breathing in water vapor from gently boiling water. And you can either breathe it through your nose or your mouth. Obviously, if you're focusing on the nasal passages, breathe through your nose. But because we don't have a kitchen stove here, we're going to just pour some very hot water into a bowl. And
Are you picturing that?
we're playing house.
You're going to have to definitely use your imagination.
Okay, so then what we're going to do, you want them to be able to breathe it, and truthfully, I think I have an oversensitivity to heat, so I would just go like this and breathe it. You know, maybe as 10 minutes if you can take it that. But if you want to make it a little more intense, you have them lean over and you put a towel over them, and this traps the steam, and it's pretty intense. And if they get a little claustrophobic, they can hold it up and get some fresh air in there. But this just makes it a little tense, so it's a little more aggressive. And then after you're finished, say he's been there for 10 minutes and he's breathing. You don't want to breathe deep continually, but just keep breathing to where you're inhaling it, okay? And then after they're finished, you just give them a cool cloth and they wash their face off and cool down. Because if they've been under this towel with the steam, it's hot, okay? So.
A couple things is, one, don't burn yourself.
Yeah.
Matter of fact, all these, please don't burn yourself. And another thing is, you can put a little bit of essential oil, eucalyptus, pine. Actually, we've gone out whenever we had pine trees around us and just got some pine needles and clipped them up into the water. And it's very, very pleasant. So you get a little aromatherapy there as well. So
yeah, it really is nice. Any of the smelly, fragrant, we'll call them, fragrant leaves, cedar, pine, any of those are very nice. Okay, let's do the end of it for the precautions. Now, just some quick cautions. The treatment should not be given to small children or elderly if they do not tolerate heat well. Anyone that doesn't tolerate heat well, you're going to want to make it milder, maybe not use the towel, something like that. Remember, hydrotherapy is always supposed to be pleasant. Sometimes we think, oh, if it burns or if it's miserable, it must be really effective. I mean, it's true. When you turn on the cold, sometimes you wouldn't say that's your favorite part. But if you've really gotten heated up, it does feel good. So remember that treat to people's tolerance. Make sure the steam is not concentrated in one area so that they get burned. That's very important. Make sure there's plenty of fresh air available. Like we said, lift up the towel a little bit or leave one side open or whatever. And only inhale it to their tolerance and comfort. So I think that's it. Okay, we'll go on to the next one. No, it's contrast shower. Contrast shower. Do that from the beginning.
have any of you, not to backtrack or anything, but did any of you growing up do that steam treatment? I remember when I was about that we'd get the croup and we would, have you heard of the croup? That's an old word, but yeah, you really couldn't breathe very good. And Mom would always put the steamer right next to the bed, and you would basically all night long, you'd be breathing this steam, and it was very, very, really break things up in your lungs and sinuses and things. So, okay, contrast shower. Of course, we're not going to demonstrate the contrast shower, but we can certainly talk about it. This is something that is available to just about everybody, except for those who only have a bathtub. But a contrast shower is an alternating hot and cold shower at specified intervals to increase the circulation and nerve stimulation. So.
And when you increase circulation, what are you doing? You're stimulating the immune system.
That's right, exactly. So what we have is just a little representation. So you start your shower. By the way, my wife and I disagree on very, very little. But when she says, these are supposed to be pleasant treatments. Anyway, the cold is not going to be that pleasant. So just know that there are some bounds to that sanguine, happy personality of hers. Okay, so to start out, you're going to start at a regular shower temperature. This is very comfortable, very nice. Then you will, for 3 minutes, 2 to 3 minutes, basically, or 3 minutes here. Then you're going to drop it slightly with the cold, and then you're going to be there for 30 seconds to 1 minute. 30 seconds to 1 minute. I say 30 seconds, that's for my wife's benefit, because she always corrects me and says, no, 30 seconds, not 1 minute. So then when you're done with that, you're going to go up for 2 minutes, and then down for 30 seconds to 1 minute, up for 2 and down. Now, do you see the graduation? Of course, you see the graduation. Our bodies have a wonderful ability to adapt pretty quickly to hot and cold temperatures. And so what felt hot a moment ago or a few minutes ago is not going to, if you had that same temperature, your nerves of your skin will actually adapt to where you can take just a little bit warmer and just a little bit cooler. That's why you can graduate it like this. Can you imagine starting out with that 3 minutes of nice warm and then dropping it to the end there of the cold? That would be a real shocker, I can tell you right now. But if you will do this, this will allow you to get hotter and colder as time goes along. Thus, the body reacts more aggressively, actually. So, did that make sense? Any questions?
Are there recommended temperatures?
Say again?
What is the recommended temperatures at those?
The temperatures. You know, if you were in a controlled environment, like if you, there are showers that have like 12, 16 heads, and the temperature gauge is, or the temperature is all controlled by a therapist. And there's a gauge there, and it's very, very specific of what you do. At home, you're not going to be able to do that. So that's why we really don't talk about temperatures. That's why at the beginning, a nice, comfortable, you start with a nice, comfortable shower, then you're going to know whether, you know, you're going to know that drop. You're going to know that you're going to be hotter than the first time whenever you first got into the shower, and so on. Does that make sense? So I don't want to dodge the question, but that's the reality.
And also, if you're doing it on yourself, you know, you can tell. When they have the temperature gauge outside the shower, that's because someone else is doing it. They don't feel it. But when you're doing it on yourself, you'll be feeling it.
Yeah, yeah. It's actually, as a therapist, it's kind of fun to do this whenever you have, I mean, the power, the feeling of power is just phenomenal. I don't want to tell all my secrets. Okay, cautions and considerations. Not recommended for the very ill patients. You might imagine that doing this up and down, you're looking at the nervous system is definitely being stimulated. Someone who is very ill, their nervous system is just working just as fast as it can work. So you don't want to debilitate anymore, make someone even more, not more ill, but just fatigued. Mm-hmm. So you want to be really careful. However,
you know, when I had COVID,
yes, by the way, we had COVID. Let's get that out, right out. Yeah, we did.
I was all I could do to do 2 minutes of hot and 30 seconds of cold, and I sometimes I only did it twice because I was already exhausted. So when you're really sick, it can be very exhausting.
Yeah.
Because I'm kind of a wimp, but.
So, yes. She said it, not me. Yes, by the way, we did. We did have that dreaded disease. But what do you think we did? We used natural remedies. We used hydrotherapy. And worked out pretty good for us. Okay, elderly and small children. And once again, it kind of has to do with the nervous system. But you can do this mildly. And if you do it mildly, you don't have to do it aggressively, just mildly. And there will be a benefit to the person. Lymphedema, once again, that has to do with actually a circulatory. You don't want to increase inflammation or congestion of a particular area because it's already congested. Advanced kidney disease, the body is definitely throwing off more poisons, so you have to be careful about that. Multiple sclerosis is, heat is very difficult for MS patients, and they enjoy cold more than hot. So once again, you can use a milder treatment for MS. Within 1 hour of eating, this is really important. Your stomach is just working like crazy. It's trying to do its job. And then you force the body to draw that blood away from the stomach, doing its job by using the hot and cold treatment. You don't want to do that. Just let your digestion work for at least an hour. Hour and a half would be better. 2 would even be better than that. And then do your treatment. Make sense? Okay. And also after ingesting alcohol or drugs. So. Just one more. All right. Mild treatment, shorter, only a 20-degree difference, which, believe me, that's not going to be, you're not going to feel it very much because the body nerves are adjusting. Advanced diabetes or heart disease. What's one of the problems with diabetes that would relate to this specifically? There you go. The nerves simply are not even mild. You don't know just how advanced that disease has become. So you have to be very, very cautious. And we're going to be talking more about specific temperatures in just a little bit. But yes, you're correct. Because of the lack of sensation, you have to be very careful with diabetics or those with diabetes. Loss of sensation, of course, that goes along very similar. Pregnancy and hyperthyroidism. So, I think.
So it's okay for hypothyroid? Hypothyroid is okay?
Yeah. Mm-hmm, mm-hmm. Yes.
That could probably be good for it.
Yeah, actually stimulate. Mm-hmm. Well, this is if you were doing it on a person, so this doesn't really apply because you're doing it to yourself at home. But just remember, if you are helping someone else, doing the shower, and you're, able to adjust the temperatures, just do it to tolerance, and remember 2 to 3 minutes hot, 30 seconds to 1 minute cold, and always, by the way, end with cold. The reason for that, by the way, that is pretty well almost over the whole gamut of treatments. You always want to end with cold, and the reason is because hot, remember what's one of the first things that was on that list? I don't expect you to remember it, but it's to dilate the blood vessels. When you have dilated blood vessels, what is the blood doing in those vessels? Is it fast or slow? It's sluggish. It's slow. So you want to kind of equalize so that the blood flow isn't sluggish in the end, and thus you end with cold. Make sense? All right, good.
Okay. Fomentations. This next one that we're going to do is fomentations. And this is really good for anytime you have lung congestion. it can be just even anytime you have some kind of an infectious disease, this will stimulate the circulation and increase the immune system, help the body to fight off the disease. It is one of the more complicated treatments, and we're going to do it really simple here tonight. You can do it with a hot foot bath at the same time, and you can put heat on their back, have them laying on heat, and that makes it more intense and more aggressive. But what we've found is if it gets too complicated, the average person doesn't use it as much. So we're going to simplify it, and we're not going to add the extras, and besides it takes a little more time, and so we're going to go through it just like this. So a fomentation is an application of moist heat, and the reason moist heat is important is because moist heat penetrates more into the body by means of a fomentation or thermophore. So I'm going to talk just a little bit about this. Fomentation is usually, this is a pad, this is somebody here in the area actually makes these now, and if you're interested in getting some hydrotherapy supplies, you can add at the resource table afterwards. You can see when some of these are available. There's different supplies that they'll have available. But usually they're 50% wool, and that helps to retain the heat. And then 50% cotton, and that helps to retain the moisture, okay? So this is what someone has made, and you can use these. Another thing that you can use is the thermophore. And the thermophore is basically just it's a big heating pad, or you can get them different sizes. They don't have to be this big. And they're moist heat. For some reason, they draw moisture out of the air. And so this is considered moist heat. It's not just like a regular heating pad. And I like to keep mine, it comes in this cover. I'm not sure what it's made out of, some fleece type thing. And I believe this is what actually draws the moisture in, the combination. That's what draws it in. But I always keep mine in a pillowcase. That way I don't have to wash this thing every time. I just throw the pillowcase in the laundry. But you just plug this in and put it on. It takes a little longer to heat than if you have these already heated. And the person usually has to hold it on because this can get hotter and hotter and hotter and hotter and hotter. And you can burn yourself. So if the person goes to sleep, their thumb relaxes and it goes off. Or they have new ones now that are on a timer and they automatically shut off after 20 minutes, which to my way of thinking, you could already be burned by that time. But so there are two things. You either hold it on or it goes off with the timer because it does just increase getting hot. So if you're going to count the 3 minutes, you could start when it gets warm. You don't start as soon as you put it on because it's probably cold. And you can use this and it enables you to do a lot more of it yourself. But I can tell you from experience, I do tell people that they can do it on themselves and then just have some cold there and put it on and you go back and forth. But when you're sick, you don't feel like doing this to yourself. My lovely husband did it on me when I had COVID. And just another little tip, when you do well, I'll tell you that later. Okay, so if you don't have either of those things, you could use a nice, thick cotton towel. And cotton is important. If it's polyester or whatever else they make them out of, it's not going to hold the heat. It's amazing how quickly it can cool down. But the cotton somehow will hold the heat longer. Okay? So, and how would you heat this? There are a number of ways. You can either use, Yeah, that's a good point. When you're using any of this, you soak them in water first, not the thermophore, but these fomentations pad. Put them in water and then wring them out. And if you have trouble wringing them, put them in your washing machine and put it on the spin cycle just for a little bit. You don't want anything to be dripping, but if you get it too dry, it doesn't hold the heat either. You know, if you put it through the whole spin cycle, it might get too dry. So just put it on for a few minutes and get the majority of the water out. So either the towel or the fomentation pad, you would get wet and make sure there's no dripping, and then you can roll them loosely because you want the heat to get in there and heat the whole pad. And you put it in probably the most common way that all of you are going to use it. You're going to use a microwave because everybody has those and it's quick and easy. You put it in just a plain shopping bag and put it so the steam is going to stay inside. And the first time you put it, maybe put it like 3 minutes the first time to heat it. And then when you take it out, it's going to be very hot. Do not burn yourself. And when that steam comes pouring out of there, it's going to burn you if you have it pointed towards you or have your hand in the way. So what I do is I flip them out like that and just let the steam escape. So you could do that with a towel as well. Another way that you can do it is you can roll them up, either the towel or the fomentation, and you can wrap them in aluminum foil and put them, like probably 3 of them, on a cookie sheet in the oven for like 50 to 60 minutes. And that will be nice and warm. That way you'll have all 3 of them ready for when you need them. About 300. Now, if you don't have a microwave or an oven, you can just take a kettle of hot water, get the water boiling or near boiling, and you take the towel and fold it like this, and here's my kettle. You dip it in the kettle and get it nice and hot, and then you start from the ends and wring it. Be sure you don't burn yourself, but just wring it out until it's not dripping at all. You have to have some good wrist muscles for that. But you can do that, and then you would wrap it in a towel. Which way steamer, can or kettle. You know those old can or kettles, the Navy ones with the white spots, they're ceramic or something. You put like 7 jars of applesauce or whatever in there. You take the rack that you usually would put the jars in, and you just leave it in the bottom. And then you take your fomentation pads, wet and wrung out, and you just stack them. There are different ways you can do it, depending. Sometimes people stack them this way if you can get them all in there, standing up. But otherwise, you can just stack them, crisscrossing them like that, have 3 of them, and that way you have hot ones as you need them. So those are some different ways that you can heat the fomentation pad. So today we're going to do it on my husband. Are you going to get on the table?
By the way, Rhonda and I just had we just recently used hydrotherapy. She tweaked her shoulder to where she was incapacitated for 2 weeks, something like that. And so we just did hot and cold to the shoulder. So
we did ice like 3 times a day for
ice and
quite a while.
Yeah, for a while, and then got into the hot and the cold treatment. So, and remember, in an acute acute injury, cold, just ice for at least 24 hours, depending on how bad the injury is. Then you can get into your hot and cold contrast to speed up the healing.
Okay, so we just took this out of the microwave. And the nice thing about the microwave, yes, is that it has a timer. You put it on, and so you can kind of tell. The second time you heat it up, you usually don't need to heat it up as long, maybe, it just depends on your unit, how powerful it is. But we have a large towel here that we're going to wrap these in, and we have it wrapped in thirds so that there's 2 layers right there, and then I'm going to put the pad in here, and then I'm going to take this layer and put it here. And that way, if it's really hot, I'm going to put 2 layers of towel between them and the heat. If it's not very hot, I can flip it over like this, and I can only put 1 layer, okay? So I'm going to carry this in there, and so I'm going to keep it warm as long as possible, and my patient is ready. And obviously, when you're doing this treatment, you don't have anything on the chest. And
I wasn't willing to do that.
we're just showing you the mechanics, okay? Okay. So I'm going to put this on his chest, and then I'm going to cover him up. They don't usually have a microphone that you're dealing with. But he wants to be able to interrupt
That's
me.
for commentary.
Yes, we'll appreciate the commentary. Okay, so how long do you think you leave the hot on there? So we're doing this to relieve the congestion. We're doing hot and cold. What did it tell you for a contrast shower? 3 minutes of hot, and then about 30 seconds of cold. Okay? So
To 1 minute of cold.
if he ever gives you a treatment, let me tell you, it will be aggressive.
And you'll be well in no time.
Okay. So I'm going to leave this on for 3 minutes. And remember, when you're giving a treatment, you don't need to be chatty Cathy. This isn't the time to tell them all your stories. Let it be quiet. Their body needs to focus on healing. If they want to talk, that's fine. But don't you be the conversation person. It's good to have it quiet, okay? So we're going to leave this on here. And if I have my little ice water over here, and when he starts to sweat, or get really hot, he probably won't with just the chest. But if you're doing the hot foot bath and he's laying on a hot one, he's going to start sweating. We'll put this over here. He'll have his glasses off, though. So, and you just change that periodically. Now, at 3 minutes, we have a bowl over here, and we have some handy-dandy little mitts. But if you don't have mittens to use for the cold, you can also use a hand towel. Just get the hand towel wet. This would need a bigger bucket for this. But get it nice and cold, wring it out, and you can use that for a cold mitten as well, for a cold friction. And a word about friction.
Can I add something?
Yes.
Is there any ice in that water?
Is there any water in the bucket? No. Yeah, he would make sure there's lots of ice. When you're doing friction on the chest, when we did it on me, my husband being the very aggressive therapist that he is, after a day, we only did it once a day, and then I did hot and cold showers, and it seems like we did something else too. But just doing that after about a day or so, I started breaking out on my chest, and it took weeks for those to heal. So we started just laying the cold on top, because the friction was just too much. So be aware of that. If you're giving these over, quite a few over a period of time, you can really irritate the skin. And that's another reason why it's a good thing to experience them, because you'll see, it feels good at first, but if you keep rubbing it. It can get irritated. Okay, so what I'm going to do while that one is still on
By
there.
the way, this is getting very hot.
Okay, sorry. So do we have 2 layers? Okay. When they say it's too hot, especially the breasts on women, it often gets too hot. You want to put more layers of towel, and sometimes if you have extra towel here, you can just tuck it under like that. But no matter how many towels you have to put under there, do not let them burn. Another thing you want to know is you can't just say, oh, is it too hot? They don't know what too hot is. They may think it's supposed to burn, right? So a good way to ask them is it stinging? If it's stinging, it's too hot, okay? And so you put more towels under there, okay? And if it's been very, very hot, sometimes you spend the whole time putting towels on, you'll learn that was too hot, okay? So while this one is still on here, I'm going to go get my other one ready. I've had it in the microwave, and it's all nice and hot now, and I have this all laid out here. And so I'm going to make my changes very quickly, because if you leave them exposed they've just had this really hot thing on their chest, and then you just expose them to the air, it breaks the effectiveness of the treatment, for one, and it's not comfortable because it's very cold then. You're very exposed. So I'm going to take this in here with me, have it ready, and I'm going to have my towel here that I'm going to dry him off with, and I'm going to get my mittens cold, or my hand towel, whichever I use.
Wrung out.
What?
Wrung out.
Wrung out, yes. And then I'm going to pull this back, and I always warn them, here comes the cold. Makes them take a deep breath, and they may yell a little bit the first time. Flip your mitts over, and the backside will still be cold because it hasn't been rubbing against them. The mittens warm up quite rapidly. Or the towel. You can flip the towel too if you use a hand towel. Okay? Now we're going to take those off, and I'm going to dry him off. Okay? Dry him off. And now I have this one all ready right here. As soon as I take that off, I have a new one to put on. One of the secrets of hot and cold is making those changes quickly. It's very important. You don't get them chilled. Now, how many times do you think you do this? How many cycles? 3. At least 3. Obviously, if it's too much for them, if they're elderly or whatever, you can do less. But usually we say at least 3 times, hot, cold, hot, cold, hot, cold. And, but you can do it more than that if they're tolerating it well. And question?
Yeah. Can you use thermophore for that, or do you have to use
Use what?
the thermophore?
Yes, you could use the thermophore. Yes. Mm-hmm. Yeah, and that really is easier, but they're pretty expensive.
What are the mitts made of?
Just towels, terry cloth. You could make your own.
Yeah, a lot of people, they'll just take older towels that they're probably going to get rid of anyway, and they can make 2 or 3 sets.
But it's nice to have a nice, not to where the terry cloth is worn down and there's no texture. You want it, it's nice to have it nice and fluffy, but sometimes they get holes or stains or something. Those are good. Okay, so we've made this change 3 times. And the last time, we're going to do a whole, well, you don't have to do a full body cold mitten if you've just done the chest. You can just finish off with the cold the last time. But if you've done hot foot bath and they've been laying on one, they're really heated up, and cold mitten all over would feel very good. And you really need it. So let me just show you how you do a cold mitten if you're going to do the full body cold friction. I'm going to have him, remember everything is covered except if you're using that particular body part. So if you could bring out your arm and hold it up. And I'm going to do long, smooth strokes. This is my cold mittens. Go in the armpit, go all the way, flip your mittens, do them again. Okay, take that off and dry it. Dry it really good, and then cover it up again. You always cover up every part that you're not doing. Then you would do this arm, and then the chest, just like we did before. I'm not going to go through the whole thing. You do it the same way, but we would have this off, and then you would take his feet out of the water. You actually put cold water on the feet, and then you bring out one leg at a time, and you do the cold mittens again. And again, long, smooth strokes. Okay? Really briskly rub them. And that feels good. Okay? And then dry them, and then cover it up again. Okay? And then you have them rest. Rest is extremely important when they're sick, especially. That's half of the treatment. So are there any questions?
What is the fomentation pad? You said it's wool and cotton. Is it layered or is it a blend?
No, it's layered. The outside is cotton on these particular ones. It's cotton, and the inside is a wool batting. And this is what if you go to the resource table, they will tell you how you can get some. What?
How are you cooling the mittens? So you're using for the friction? Is that
I put them in ice water. Yeah. Yeah. And then when you go like this on the body, they heat up. And so then if you flip them around, the part that's been on the back side of your hand and use that, it's like cool again. So that increases the amount of time.
I used to work in a cath lab a long time ago. We used to heat our patients up on the way back and do the heart cath by putting a blanket in a microwave. Make sure it's very wet because it will start fire.
Yes, that is true. I have had that experience. Yes, make sure, sometimes if we were using them on a number of people, we didn't re-wet them, and they would get kind of dry, and yes, they can start a fire in the microwave. So if you've done some of these things for a while, you've had lots of experiences, but you learn from them. You want to finish it off? Okay, we talked about this already. We talked about the microwave method. That's what is the most convenient for most of us at this time. Oven method, wrapping them in foil, canning kettle method, stacking them in there, and boiling water. Cautions and considerations: never use this treatment on an unconscious patient, and why is that? What? They can't tell, you can't tell if you're being burned. I mean, they can't tell you. Never use this treatment for internal or external bleeding. Why? It's going to draw more blood to that area and make it bleed worse. An acute injury should not be treated with hot, treat it with cold at first. Fomentations may also include a hot foot bath. We talked about that. Treat impaired circulation and impaired nerve sensory mildly. Someone who has neuropathy, or if they have nerve sensation or even circulation impairment from, maybe they have lymphedema or anything like that, the body can't handle bringing in more blood to that area. And you could just do maybe cool and cooler or something, do them very mild. To prevent burning, that's the main thing you need to prevent. Use consistent communication. That's where if you're talking, they don't want to interrupt you. I'm burning, but they can't interrupt this interesting story, you know. So you're not talking, they are, if they want to. Remember, moisture intensifies the heating of the skin. That's why you always want to make sure that they're not burning. Bony prominences burn easily, and when you're laying on your back, your tailbone area and your shoulder blades are two areas that will get hot before everything else. To prevent burning yourself, remember that the fomentation, remember when we took it out of the oven? Be careful, the bag can really, steam coming out of there can really burn, so handle that with care. 3 to 5 minutes of hot stimulates. It brings the blood in, but then you want the cold to shunt the waste products and the heated blood out. If you want to just do a sedative thing for a relaxing thing, 6 to 10 minutes, and then you may not want to end with real cold. You may just want it, but that's a different treatment. And there are variations of all of these that, you know, use them, vary them a little bit for this or that, but these are some basic things that are good for dealing with acute illnesses. Good, we still have 20 more minutes. Okay, our next one is Rich is going to talk about the hot tub bath. This is one of our favorites. When we start to get sick, we'll get up in the middle of the night and go take a hot tub bath because it's that effective. But you need to get on it right now, even in the middle of the night.
That's a very good point, by the way. That's a very good point, by the way. Illness, when there is something bad in your body, a virus or even bacteria, those have the ability to multiply extremely quickly. And so the faster that you can address that, interrupting that replication, the sooner and faster you're going to be able to get rid of the illness. So when she says, you know, you wake up in the middle of the night, you're not feeling good, you don't want to get up and do a treatment, that's really, it's the best time to do it, even though you don't feel like it, because you have started to interrupt that replication. And so for every hour that you wait, it's just that many more bugs that are multiplying. So just kind of keep that in mind. Okay, a hot tub bath, given with water temperatures in the range of hot, 100 to 104 degrees, to very hot, above 104 degrees, covering as much of the body as possible. Thus, the more modern tubs, I don't know how they can even call them tubs anymore, but the old-time fashion bathtubs used to really, you just, you know, really cover the whole body, but now it's more difficult. I think the main thing is that you want to make sure, if you're going to cover anything, make sure that it is the trunk. So from the shoulders down to the waist, or actually to the upper thighs. So if you have to bend your knees, in other words, that's better than sitting up and just having your legs, because you want to have the largest amount of skin surface exposed to the heat. So when you're doing a treatment, there's several things that you have to do. You have to kind of prepare for, this is a preparation for when you're done with the hot tub bath. And so what you'll do is you will get your bed prepared, and when you get out of a hot tub bath, you are going to be sweating, perspiring. And so if you don't want to have to change your sheets, because when you're finished with that hot tub bath, you're going to bed. That's another part of the treatment. You remember Rhonda just said that the after the treatment rest is 50% of the treatment, just about. You know, maybe not be that much, but it's super important, that rest after the treatment. So you don't just do any treatment, get up and go about your daily tasks. The rest is extremely important. So what you'll do is you'll get like a plastic sheet that you can put in the bed, and maybe even a plastic sheet over the top of the pillow because your head's going to be sweating as well, even though you're going to be using, as we'll talk about in just a moment, you're going to be using cold on your head. You're still going to be sweating. So then whenever you get in, you're not going to be getting your sheets wet to where you have to change them. You can just take, when you're done in bed with your rest period, then you can just take those plastic sheets away, or plastic.
Well, and you can wrap up in a sheet too.
Yeah.
That
exactly.
helps absorb the sweat.
Yeah, and we'll talk about that in just a minute. So that's kind of, does this make sense? Main thing is, whatever it takes, don't get your bed wet, because you don't want to have to change the sheets. So, cautions and considerations.
Go through the procedure. Go through the procedure first.
Okay, what we're going to do is, let me go back to that. So, in a hot tub bath, you're going to go ahead and draw the water, and if you have a thermometer, that would be good. And the thermometers, you just go down to your local store, and for about $8 you can get one of those cooking thermometers. But make sure that it is not like a turkey, that thing, you know, like it starts at 150 degrees and goes to 250 or 3, whatever it is. Have it so that it'll go from below zero, below freezing, to maybe 130 degrees. And digital is the best. Very, very handy, because you just put it in, and they are very quick. They can tell you the temperature really quickly. So for $8, you can have a probe thermometer that you just put in the water, and it, really within a few seconds, it shows you what the temperature is. So if you are a healthy person and you know that you have no sensitivity problems, no nerve problems, then it's not imperative that you use a thermometer. But if you know that you have some impairment problems, you really should get a thermometer, so that you don't hurt yourself. So you'll start off probably at around maybe 102 degrees, maybe 104 degrees. Hot tubs, by the way, just to give you a little bit of an idea, a little reference point, hot tubs many times in a public facility will be around 104 degrees. Well, there's a reason why they have it at 104 degrees and not above. And that is because a lot of people have nerve problems. So just remember, 102, 104, right around in there. Go ahead and get on in, just like you're taking a regular bath. Now, I got to back up. You're going to want to get a pitcher of water, and have this pitcher of water right by the tub, because you're going to want to drink, well, at least a quart. I usually have a pitcher about this size, and I put it right there, and I drink right out of the pitcher. Because you're sweating, you want to just really guzzle the water. And by the way, what was probably one of the reasons that you got ill in the first place? You were probably chronically dehydrated. So once again, this is a part of hydrotherapy, and that is drinking lots and lots, copious amounts of water while you're in the tub. Another thing is, you'll have a little something or other like this with iced water in it with a washcloth, so that whenever you start sweating, and some people, if your head is a little bit sensitive or you get headaches kind of easily, you'll want to make sure that you have cold on your head basically constantly. Now, that's not at the very beginning. Give yourself a little bit of time for your body to heat up. Then start taking your washcloth, nice and thick washcloth, and then put it on your head. And keep your brain cool. Your brain does not like hot, so keep your brain cool.
And you'll tolerate the heat much better if your brain
It's just
is cool.
almost miraculous how much more you can tolerate heat with cold on your head. So now you're going along, and the water is beginning to feel a little bit coolish. So what you want to do is you will let some of the water out, just pull the plug or whatever you do for your tub. Start it draining a little bit, and then turn on your hot water. put in more hot water because your body is adjusting. Now you can go from 102, 104, 106, 108. I wouldn't go above 110 degrees. By the way, if you were to get into 110 degrees at the very beginning, you wouldn't be able to do it. It's just,
But you know, interestingly, even if the water isn't that hot, because you have so much of your body under the water, it really heats you
it really
up.
heats you up very, very
So we don't need it
efficiently.
that hot. And usually our home water tanks don't hold that much water anyway.
No. So, you know, right around 106 degrees, 107 degrees. You want to keep it to where it's nice and toasty warm. So you'll put the plug back, turn the water off. When you are putting that hot water in, make sure that your feet are not anywhere close to that spigot because you're turning on just the hot, so you don't want to burn yourself. Okay, timing. You'll want to be in the tub for between 15 and at the very most 30 minutes. 20 minutes seems to be about the sweet spot, 20 minutes. I personally like it a little bit longer than that. My wimpy little wife likes it a little bit less than that.
I have to have music and
Oh,
everything to
it's
distract me.
distraction. I tell you, I mean, we've got to have Montavani on for her, you know? So, anyway, so, okay, you're all done with your 20 minutes, let's say, at 106, 107 degrees, and you will go ahead and what I'll do is when I'm getting out, I will go ahead and dry off and have a sheet, like a single sheet, right next to the tub. So I'll be dry, but I'm still sweating, remember. I'm going to wrap that sheet around me and trudge off to bed. Then I'm going to get into bed where I have the plastic sheeting so that I don't get my bed wet. And I'm going to be there, generally speaking, 45 minutes is just about minimum. But if you're looking at, you want to get rid of this fast, you give yourself about an hour. And most of the time you'll just go to sleep. So it's very, very nice. This is a lovely treatment, actually. It's very nice.
And be sure to cover your head because your head is really sweating, and I actually get really cold if I don't put something,
have a dry towel
over my
Have
head.
a dry towel that you can kind of wrap around your head. So I know there's a lot of information coming at you, but does it kind of make sense? So dry towel, sheet around you, into bed, stay warm. Let the heat dissipate naturally. When you are done, and that hour's time, when you're all done, trudge back into the bathroom, do a cleansing shower then. And then keep drinking your water, do whatever it takes, do the right things to get well. So, and by the way, to give you a little bit of an idea from experience, when we have utilized this on ourselves, it seems like that it cuts the time of an illness. If we have waited too long and we get ill, it cuts the time of the illness by about half. So, and you say, well, how do you know that? Well, because usually people around you are ill as well, you know? It's like kind of like, these were the symptoms that I had. What symptoms did you have when this first started? And so you're talking to people and you realize, okay, you got the same bug they had, and this is how long it took them to get well. And so by that, you kind of calculate, but it takes about 50%. So it shows how powerful hot can be to do that. So, okay, any questions?
We have 5 minutes.
Okay.
We have 5 minutes.
Okay.
Hot foot bath.
We have 5 more minutes left. We're going to do a hot foot bath really quickly. You've probably all done hot foot baths, but we're going to do one here. So.
The hot foot bath is a very simple thing, and we always say, you know, if you don't know what treatment to do, do a hot foot bath. It is so simple, and yet it stimulates the immune system and the circulation, and you know, you can do it with very little equipment. You can do, if you're doing it like for an infection or your toe or something, you can do hot and cold, just 3 minutes hot, 30 seconds cold, back and forth. And end with cold, that's right. But we're just going to do hot now. And this not only increases the whole body circulation, but this is great if you have a congestion headache. It draws the blood away from your head down to your feet and will relieve a congestion headache. If you're even if it's a stress tension headache, sometimes it'll help relax and equalize the circulation enough to where you'll be able to, it relieves it. So it's nice to put something down on the floor so in case anything spills, but also then we can dry his feet with that afterwards. And go ahead and we'll put your feet in. We've got nice hot water. How's that feel?
Very nice.
And if they're diabetic, you don't go above 102. 102 degrees. Oh, you want to be able to correct me, huh? And then you can let them sit there for 20 minutes, and you'll probably have to get the water hotter. And so you'll take some water out because you don't want to overflow. And then I've got some nice hot water here, and you have them move their feet to one side, and you swish as you pour in. How does that feel?
Much better.
Okay.
Much better.
Yeah. Okay. So you keep the water nice and warm. And like I say, this is a very effective treatment. And if you want to wrap them up in a sheet, that actually helps keep them warm, especially if the room is cold. You can sit on the side of the tub and do this too. That's where I usually do mine. Then I can just turn the faucet on and I have hot water. But just make sure they're nice and warm.
Yeah, it's very efficient in the tub.
Yeah.
You don't have to worry about spillage or anything. So.
And just make sure the sheet doesn't go in the bucket if you put a sheet around them. And this reminds me, I'm just going to talk about it for a second, but you can actually do a steam bath. If I have this with a hot foot bath and I put like a rice cooker or something with water in it underneath the chair, you'd not want to use a metal chair, but a plastic chair or whatever, and put it in there, and it makes a nice tent. And remember Dr. Schwelt talked about the sauna. That's kind of your own personal little sauna. And it's a very intense treatment, so you want to make sure to keep cold around their neck. That's the most effective place to put it when they're sitting up like this, and keep the sheet nice and tight around there. Keep their head cool, and you'll need to change it every minute or two because they won't tolerate it well otherwise. And if they start to get lightheaded or anything, you stop the treatment and cool them down. And you can just have them run and take a shower afterwards. Now, about the hot tub bath, one thing I was going to say with that can be very intense. And if the person gets lightheaded, if you give it on yourself, you should know what your reaction to this is going to be. If you're giving it on someone else, stay with them. And if they do get lightheaded or pass out, just pull the plug and turn on the cold water. Keep their head above water. And sometimes you want to cool them down before you have them stand up, because if they're lightheaded or something and then you have them stand up, they're going to go right back down. Now, that's not, most people that doesn't happen to, but I'm just telling you that if that does, help them down, cool them off, and they'll come to. Okay? Any questions? Foot bath is real simple, but I think we all know how to do that.
What about a deeper foot bath where you get the whole calf?
That's even better. The higher, the better. But that brings up a good point. You should have at least the ankles covered. If you can have one at least that deep, that's the minimum.
How are you going to cool my feet off?
Oh, yes. At the end of the treatment, we're going to use some cold water this time, and we're going to have him lift his feet up and pour the cold water over it and pull this out and put your feet on there, and then dry their feet real well between their toes and everything, and then be sure to have them get on some socks and slippers before they go to bed. okay? So I think that's it, Kim. Dr. Azelton.
Alrighty. Well, thank you so much, Rich and Rhonda. We appreciate it. Yes, definitely. Thank them. You guys came out all the way from Arizona. We greatly appreciate that, and they're also headed to Berrien Springs to help out with the hydrotherapy treatments that they're doing down there as well. So did you learn something tonight? Yeah, awesome. Thank you guys so much. I worked with you guys back when I was in college and just learning hydrotherapy. So greatly appreciate having some of my teachers out here to teach some of you guys. And we've greatly appreciated it in Renovate as well. There's a number of us that are, a number of people that are learning hydrotherapy and getting to experience it in Renovate. How many of you have experienced hydrotherapy? Awesome! Look at that. Very awesome.
Great.
These are great students, and they can just increase their skills. Hydrotherapy Hub has a great training course, so you can check out their website. We also have, and Rich and Rhonda are also teachers on that. And we also have the Hydrotherapy Supplies that you can get through with Hydrotherapy Hub as well. Like Rich and Rhonda said, a lot of these you can make yourself, or you can use towels that you have yourself. So you don't need any of this extra stuff. It just makes it a little nicer. So it's available back on the resource table if you guys would like to check that out. And there's some samples here.
Kim,
Yes.
tell them that we do it. DVD.
Oh, yes. Would you like to tell us about the DVD and where they can get that?
We do have a DVD where we go through like 10 different treatments. And if you go online to ariseandshinehealth.com, ariseandshinehealth.com, you can order them there. I do have some with me, but anyway.
You just discovered some unknown secrets that a lot of people don't know about how to get well when you're sick. Most physicians will say, "Oh, you just have a cold. Go home and you just have COVID. Just go home and let us know if it gets worse." No, there's actually a lot that you can do for yourself, and you just stumbled upon an awesome resources with Arise and Shine Health for the DVD and Hydrotherapy Hub, and there's a number of other websites as well. Saturday night, I'm really looking forward to that. We've been talking a lot about stress, immunity. We're actually going to just go to a whole nother corner, talking about uncovering the secrets and things like that about stress and immunity. So we're actually looking at a centuries-old solution for stress. It's actually right in the Bible. So you will not want to miss that. That is Saturday night at 6:30. And I'm very excited you guys came. We will look forward to seeing you Saturday. Let us have a closing word of prayer. Dear Father in heaven, thank you so much for making our bodies so just miraculously to be able to heal from sicknesses. And we just pray that you teach us even more how we can use these things and recover to full health and help our neighbors and friends do the same. We pray this in your precious and holy name. Amen. Have a good evening.
Thanks, everybody.